Okay, thank you very much. So I'll use my 9 minutes wisely. Although I don't think that's fair. Anyway. Um, okay, well, I'm the lead of Working Group 3, and we're doing something. Oh, all right. And we're taking a different tack from the other two groups, and we're looking to contextualize the birth and the birth experience in the socio-cultural context. So our group was looking more at the sociological aspects of birth and trying to think about how does society contribute to good birth, or how does society not contribute to that. And one of our key themes within that strand was to look at migrant women and marginalised groups. So we've had a big programme of work on that. So, as Anastasia said, what COST does is it facilitates you to meet. And there's a lot of challenges because one of the great things about it is it brings together a lot of different groups, but that also makes working together sometimes very challenging. So that's all of us looking a bit tired and despondent in Crete, but that was only because we've been working so hard, and actually we jazzy later. And that's only a very small number of the people who have been involved in Working Group 3. So just, okay, so we had a number of groups, so we decided that we'd divide ourselves into broadly 4 working groups and then various subgroups in that. And we had one group that wanted to focus on experiences of childbirth. And then we had another group that was looking at values in healthcare. So we thought it was also important because I think a lot of the time, although we want to base practice on evidence, actually what very much influences society and people's practices is the values and the ideologies they bring to the enterprise. So I think we can only, in a sense, do so much with evidence. We also need to win people's hearts and minds. So we had a group talking about values in healthcare and what kind of values drove people to certain actions. And then we had the Migrant Women group that was led by Marie Claire, who can't be here unfortunately, and Mel Cooper. And finally, a group that was looking at how we measure and define women's satisfaction with care. Because this is another important issue, how we actually define good outcomes. And are we thinking about outcomes that are important to the people involved? Or are we thinking about good outcomes that are useful for the hospital or the Department of Health and so on? So we wanted to unpack this notion of what made people and women particularly satisfied with their care. So, like all the working groups, we had a wide range of people from lots of different countries, and I'm sure, and I'll just have a caveat, if I've left anyone out or anybody or any topics, it's only because I've now only got 9 minutes, even though I thought I had 12. So it's because I haven't got that 3 minutes. So. But, you know, this is a bit of a whistle-stop tour, so apologies if anyone feels they've been left out. We also had a wide range of disciplines. So we had midwives, doctors, sociologists, bioethicists, anthropologists, psychologists. And this made working together sometimes challenging, but also, I think, much more rewarding. So we had a huge variety of perspectives. We had lots of language difficulties, misunderstandings, but I think that also made our work a lot stronger. And it made it very different from the kind of work I think we all do in our kind of day jobs, that we tend to work very much with people in our own countries, with our own perspectives. And it's very good to be challenged, you know, what do you mean by this? And be challenged in the way you do things. That when you work with people in a similar system, you get very used to not particularly questioning some of the parts of your system. So we worked on a huge range of topics, and this is just a quick sample, and then I'm going to give you 2 case studies to give you a bit more of a detail of what we did. So we worked on some big data sets, the Babies Born Better data that you'll be hearing about at some point in this conference. We looked at midwives' perspectives on the ethics of abortion, Sarah Church is organising something on human rights in maternity care. We also wanted to look at access of healthcare for migrant women across Europe, because that was something that makes it very useful for us to do in terms of we've got a wide range of people from different countries, so we can find out what's going on in other places. We also started a photo voice project that was documenting women's experiences, and finally looking at satisfaction. So just to turn to 2 case studies, and these aren't exemplars, they're just 2 areas that I thought I'd give you a flavour of so you can see what we did. And one of the areas when we were looking at values in maternity care was conscientious objection. And that's basically the ability to opt out on conscience grounds because you morally disagree with something from participating in a particular practice. And that obviously comes up very much in debates over abortion and so on. So we had a piece of work that was led by Valerie Fleming, who at the time was in Switzerland but has now come to the UK and is working in Liverpool, in the same city as me. And she led on this paper where we did a systematic review of reasons people gave for conscientious objection. And one of the things we wanted to do is focus particularly on midwives and, where relevant, nurses' experiences of this. Because often in the literature, a lot of it is taught, doctors are the sort of obstetricians are the focus of this. But we wanted to look at midwives and nurses. And Val has published a number of papers, and this is our recent paper in BMC Medical Ethics that is open access on this. And secondly, out of this work, we've also got a grant by a UK funder to look at understanding conscientious objection and how healthcare professionals approach it. So we've got some money to gather empirical evidence on this, to synthesize evidence in the ethical, legal and medical literature, and also look at which elements of the abortion process should professionals be permitted to withdraw from on grounds of conscience. So that's a project that we've had our first meeting last week, and that's arisen out of the cost action. Okay, so the second case study is from the Migrant Women group, and they've done an awful lot of work, so again, apologies for missing out things. And this was a concept analysis of the very concept of migrant women. Because although we talk a lot about migrant women, there is some ambiguity about what that actually means. How do you define migrants? And in some senses, you could argue we're all migrants. And their paper was an attempt to unpack this. And this is about, again, this paper is open access, because one of the things the cost action has done is funded papers to be open access. So that's also been a great thing to get our research out there. And they argued that there needs to be a sort of definition of migrant women that can be used in research and also to determine access and good care and so on. And as part of the Migrant Women group, Emma and Elena got a grant from the Czech Science Foundation to look at the experiences of migrant women in the Czech Republic and to have some empirical insights into their experiences, to see what has shaped their maternal health and their experiences throughout the pregnancy, birth and antenatal period. And that's a piece of ongoing work. So we've aimed to try and generate some further projects. So future plans, Sue has mentioned some of them. We're doing a +1 special collection based on this action, building impartial research through health. And that should be coming out end of next year. So that will be open access. And we're also going to hopefully keep working together and exploring ways of furthering and developing our links. And finally, I'd like to thank all the members of Working Group 3. I know quite a few of them aren't able to be here, but they've all been wonderful and I've really enjoyed working with you. And also the wider action. It's been an amazing experience. And to Sue for being our inspiring leader. And I will close there. And of course, Ramon,
Wonderful.
our chair.